It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Well, my friends, what do we know about the Express Care location on Broad Street at the Hazleton Shopping Center? Well, today we're going to learn a lot about it, and it's going to be surprising to you to find out all that is available that Lehigh Valley Hospital Hazleton has to offer. Today, we have Alyssa Hartranft, as I'm saying that correct? Hartranft, who is a physician's assistant, certified, who not only works at Express Care, but also you're at the ER unit, is
That's
right?
Correct, yep.
So, well, welcome to the show.
Thank you for having me.
So tell me, Lehigh Valley Hospital has been no stranger to you. You've been around for a little while, haven't you?
Yeah, so when I was a student in PA school, I actually, my rotation for the emergency room was actually with the Hazleton group, and I was with them for a total of 4.5 months, so I got to know them really well. My first job out of PA school was with our orthopedic group up on Airport Road there, and then I took a little hiatus from Hazleton and went to North Carolina, but now I'm back for another year. So yeah, I've gotten to know the area and the group very well with Lehigh Valley.
So tell me, the physician's assistants, I mean, really came to play in the last number of years, okay? And so why do you decide to get involved in healthcare?
Well, I always knew I wanted to do healthcare pretty early on in high school. I got lucky in that regard, but it was trying to pinpoint whether I wanted to do like a nursing route or med school. And I actually, strangely enough, thinking about it, came up to Hazleton to shadow. Just they kind of put me with a bunch of different people to get a feel for different professions within the healthcare. So I was at the hospital and I shadowed like a pharmacist at the time, and eventually a PA, and I was like, I really like the kind of the role of the PA, because you get that feel of someone's always kind of has your back, being your attending physician if you need it, but it's also a very autonomous field where you make decisions for yourself, you are able to prescribe and do orders and make do diagnoses and whatnot. So it's kind of like a happy medium. The schooling isn't as much, it's just as intense, but not as much. So in that regard, it kind of saves time and money, but at the same time, you're getting that that same feel of, like, I like the ER especially for the autonomy of it. Like, I feel like I'm making decisions on my own, but if something critical came in, I obviously have a doc to back me up. So like I said, for me, it's a happy medium. It still gives me that like good life outside of work too. Not as many student loans, which is always nice. So for me, it was just a good fit. Okay, so now here's the concern. Okay, come into ER, come into Express Care, okay, sure, which is a great opportunity for Hazleton. I see you. You look like you're a kid. You look like you're 12, 13 years old. I've gotten that so much, honestly.
Well, so the point is, my first question, well, what does she know about? Is she going to take care of me?
Right.
Okay, so tell me about your experience, because I know you wouldn't be there if you didn't have the experience. But, sure, for the first time saying, she's a kid, what's your experience?
So there is, just to kind of put it on the table, there is a lot of younger PAs out there. A lot of people are going directly from college right to PA school without really taking that break of taking a job in the middle. So there are quite a bit of us out there in our early to mid-20s that are starting in this profession. But like I said, we have a very rigorous training program. We go through 12 months of basically classroom training, where they're basically just throwing as many medical things at us, and whatever sticks kind of sticks. And then we have 15 months of on-the-job, hands-on training in different specialties, whether it's orthopedics, surgery, emergency medicine, pediatrics. So we do have a very condensed training within that 27 months for PA school. Myself, we had the option at, I went to Marywood University, where I got my bachelor's in science, as well as as well as my master's in PA studies, and we had the option there in PA school to do what they call a specialty track, which means if you had like a particular interest in a specialty, you could do an additional 3 months in that specialty during your training. So in addition to the mandatory 6 weeks of emergency medicine training, I did an additional 3 months with the Hazleton group here. So I got 4.5 months of training as a student in emergency medicine. My first job out of school was actually in orthopedic surgery for Lehigh, so I did that for about a year. Then I went down to North Carolina and did a year of emergency medicine down there as well. That hospital was actually the biggest and the busiest in the entire state of North Carolina, so it was a very good learning experience. And then I decided to come home. And now I've been with this group back in the emergency room in Express Care for just over a year now. So about over 3 years of practicing.
So you have some good experience, okay, and you have a lot of new stuff then, because there's a lot of new things happening all the time. What does a PA do?
So,
Physician's assistant, and you're certified, okay?
Correct, yeah.
So what's the difference between being a PA and a certified PA?
Nothing.
Okay.
Basically,
that's
the certification, it comes from the national board, the NCCPA, which is when we take our national boards and we pass, we get that C tacked after the name, so it becomes PAC. So I mean, you hear of like PAS, that would be like a PA student, so that kind of can help differentiate between like a PAC too. But the C just means that we passed our boards, which allows us to practice. But the role of a PA is a little bit, it depends what specialty you're in for the most part.
What specialty are you in?
Emergency medicine right now.
Okay.
Now we have the option to switch back and forth because, like I said, I did orthopedic surgery for a year, and then I switched back to emergency medicine, which is kind of one of the nice parts about our profession is we're not locked into one in particular. If we ever wanted to switch, like if I wanted to do pediatrics, I could go do pediatrics without any additional training. So in the role of emergency medicine and express care is unique because you're only ever going to see a physician assistant or a nurse practitioner there. There are no doctors on site.
Okay. So when you just said that, so we should feel comfortable, okay, because I want to see the doctor. I want to see the doctor. And we've talked about this with a number of PAs on the show, but just to give them that comfort feeling, or say, so that they're in good hands.
Right. I mean, especially at Express Care, all of our PAs and NPs, they have to remember, are emergency medicine trained. We all float through the emergency room, which, most people, when they compare emergency room to Express Care, they would think that the emergency room would be the more serious patients, more critical patients, whereas Express Care is, the minor injuries, minor illnesses. So knowing that we are all, trained in this emergency medicine type of like in that facility, when we go over to Express Care, what we're seeing over there is not foreign whatsoever. Okay. We have that training, and a lot of the PAs and nurse practitioners that we work with, they've been doing this such a long time. I mean, one of our PAs, he's been doing this as long as I've been alive. So, we have a lot of experience within our particular group at our Express Care location.
What are some of the, at the Express Care, there's always, excuse me, there's always the distinction of like, where do I go? Okay, I mean, if you're having some, all right, so where do I go? Okay, if do I come to Express Care if I'm feeling what?
Right.
And when do I go to the emergency room?
Right. So that's always like very, I think, subjective, because if you're not trained in medicine, you obviously don't know what you're dealing with maybe. So we try to generalize it as best we can. If minor illnesses, so cough, cold, flu-like symptoms, minor injuries like an ankle sprain, or maybe got your finger slammed in a door.
That hurts.
It does. The nice part about our Express Care too is we have X-ray at our location, which we could talk about. So we do like the minor stuff, the stuff that you can probably see your family doctor for, but it's not really worth waiting the 2 or 3 days, because it's very hard nowadays. I'm finding for people to get into their family doctor's office for like a sick visit. So Express Care is a great way for you to not have to kind of sit at home for 2 to 3 days with a fever and not really know what the source is, or not have that X-ray of your ankle or what have you. But we always tell people that if you're having any sort of chest pain is a big one. Like, we obviously don't want to miss something with your heart. We have very limited testing in Express Care for that, so chest pain is a big one. Severe abdominal pain, we do have X-ray, but we don't have CAT scan. We don't have blood work, unfortunately. So it's you have to kind of really, it's an education thing, I think, for patients, because we do end up sending people from Express Care to the emergency room who we know they need a bigger workup than we can provide them at Express Care. So there is some material out there through Lehigh and just in general on the internet about like what would be appropriate, but the best way to summarize it is very minor illnesses and injuries at Express Care, whereas the ER is better suited if you have more of a serious issue going on that would require things like blood work, a CAT scan, possible admission into the facility, that sort of thing.
I would think, because that you're working on both locations, that you would have a pretty good idea when someone's coming in whether they should go up to the ER.
Yeah.
I mean, you'd say, well, look, this person's not for here.
Right.
We have to send them up to the ER. And I'm
Right.
sure that, with that experience, that's good to know that, because sometimes people, as we're talking about Express Care, and it's a great opportunity, we'll talk about why it is such a great opportunity. You feel comfortable. All right, if you walk in, look, we have to take it. Now, do you take people up if there's an emergency, or do they have to drive up, or how does that work?
So it depends.
Person comes in. They're having pain. They don't know whether it's a heart attack or
Right.
whatever. Okay, and they drove. Okay, what do you do?
We always give. Obviously, if the patient's unstable, we do what we need to do there to try to stabilize them as best we can with our resources. But we do have, a direct line to our APTS, our ambulance providers, that they can come up and take them to the ER. We've done that before. We've called the ambulance before. But there's other people, they might come in with like abdominal pain and, they probably need some blood work and a CAT scan where it's not apparently life-threatening at that point, and we give them the option. We say, would you like us to call an ambulance, or do you have someone that can drive you? Most people, they choose the private vehicle route. Like I said, as long as they're stable, it's a mile drive up the road, so we're okay with them doing that as long as they're with somebody. But we have had cases where we have to call the ambulance to have them transported up there under the supervision of our EMS personnel.
I remember doing a show up there when they first opened, and so just for the sake of the viewers, tell us what's in the Express Care. What's available there.
Sure.
Okay.
Yeah. So, like I said, Express Care is a great little place that for the minor stuff, cough, cold, flu, minor injuries. We have limited testing there. Like we can test for flu, strep throat, which is very common in our pediatric population. We have like urine tests, and then we actually are lucky enough to have an X-ray right on campus, or right in actual Express Care, because people get, I know, a little bit worried about us having to send them up to the hospital for X-rays, but we have it right there, which is nice because not a lot of Express Cares have that option. Not necessarily through Lehigh, but just other Express Care locations. So that's always nice to have that. And then, like I said, we're fully staffed. We have about 5 rooms that we run patients out of. There's 2 PAs there. The majority of the day for 8 hours. There's always double coverage. So yeah.
So you're right next to the pediatric.
We are. Okay. We don't have anything to do with them necessarily.
Yeah.
It just.
But they're doctors there.
Yeah, so the pediatricians and the pediatric PAs they basically sit right next to us. They have their own schedule. It kind of worked out that way. We end up seeing quite a bit of the pediatric sick visits just because they're kind of right next to each other. Wasn't planned that way, but it just happens to work that way.
Look, the reason why I think is, here again, emergency is emergency.
Yeah.
So someone comes in and God forbid, you need a doctor immediately,
right.
Okay? They're right next door. I mean, I'm not saying it's routine, but you always have to have that comfort feeling. Folks, I'm talking to Alyssa Hartranft, right?
Hartranft.
Okay. Who is, can't you have a name like Smith? Alyssa, I love. That's my granddaughter's name. Okay, I'm sorry. I know your grandma,
Yeah.
She's a very nice person. Now, Express Care, let me give you a number, folks, because, if you're not feeling well and you want to go to Express Care and maybe it's something they could say, don't come here, you better go to the ER. I'm giving you the number is 570-501-6220. It's different than the other number I usually give you. So it's 570-501-6220. So we come back, we'll talk a little bit more about Express Care and what's available here. And there's an expansion going on you want to hear about in Hazleton. They're always doing something, the Hazleton, Lehigh Valley, Hazleton. They're always doing something exciting. We'll be back right after this. Welcome back to the Sam Lesante Show, folks. Remember, 24/7, you get to watch all of our health shows on ssptv.com. And most importantly, folks, shows like this that bring you a lot of information, download our app. Search SSP TV, download the app, and every show is on here, particularly when it comes to healthcare. My guest today is Alyssa Hartranft. She is a physician, certified physician's assistant, working at the Express Care unit location here in Hazleton, in the Hazleton Shopping Center. And remember, folks, if you want to write the number down in case you are not feeling well and you need to know where to go, whether the ER or Express Care, it's 570-501-6220. And we're talking about all of the things that are available. Now, you mentioned some of the things. Now, once again, just so we could, for people who are going to the channels, they should be watching this all right through. They're going right to the channel. What are some of the most common injuries, conditions you see in patients? These are the most common ones that you would see at Express Care.
Most common illnesses that we're seeing, we do see a lot of pediatrics, so strep throat, especially when school kind of kicks back in, common colds, now we're in flu season, so that's going to be a big one. Get your flu shot.
Okay, now, you said get your flu shot. Now, some people, okay, are afraid to get a flu shot because they hear stories.
Right.
I got the flu shot and I got sick, okay? And so that scares them, okay? How do you comfort those people who are fearful of that?
So I think the big thing is you're not going to get the flu from the flu shot. That's people's biggest fear. Yes, you might have a low-grade fever for a day or two, have some muscle aches for a day or two, but that's not the flu. That's your immune system basically responding to the dead flu the dead flu virus from the vaccine. But it's not actually the flu. But you have to ask yourself, I guess, do you want to just kind of feel a little lousy for 2 days or feel...
But that doesn't happen to everybody.
It doesn't.
Okay.
No, absolutely.
So I'm just saying some of those people that it does happen to, those are the ones that say, don't get the flu shot. I got sick. I was,
That's worst case scenario.
Yeah,
that you might feel a little under the weather for a day or two. But most people really, they just kind of have a little local reaction to the site, just like a little soreness, maybe some redness. But other than that, there's really no... terrible side effects.
You, but when you said the flu shot, I wanted to make sure that we had that. All right, so continue on. What others?
Yeah, so flu, upper respiratory infections in general, whether it be bronchitis. I have had a few cases of pneumonia in there. And then some minor belly issues. Maybe they just kind of had the nausea, vomiting for a couple days, or a urinary tract infection. And then we see minor injuries too, so ankle sprains. I've seen some wrist fractures, some finger fractures, some very minor lacerations. And like I said, there's those that come in that kind of need a little bit more of a workup. So, the elderly person on a blood thinner who falls, hits their head, they have a small laceration, they really need that CAT scan to make sure they didn't do any worse damage with, being on the blood thinner and everything. So those people we do recommend going up to the emergency room. But like I said, minor stuff, mostly, upper respiratory, mild, GI stuff, and then some minor injuries.
And once again, you have that experience because you work at the ER, and you rotate between the. You work every other day, or how does that work?
No rhyme or reason to the schedule, really.
So otherwise, they need you here. You're there.
Yeah. I mean, the schedule comes out 2 months in advance, and it's just kind of making everything equal. We have one of our lead nurse practitioners who does the schedule for us, but it's all kind of planned in advance.
And I know this for a fact because I had, unfortunate but fortunate, we went to the ER. We had to bring someone from our family up there, and I'll tell you, they're absolutely fantastic. I mean, really, we're blessed. And I'm just, because when we went there and it was total care, expert, and the nurses, the doctors, the physicians, assistants, even the receptionists were absolutely fantastic, and my hat's off. You have a tough job, because really when you come in and you're sick and you're not feeling good, they're depending on you to give them direction. And like I said, when you look at you, you say, well, there's a kid, okay? But however, you have and you wouldn't be there if you didn't have those experiences. But now there's other things that you do at Express Care, right? So what are some of the additional things?
Yeah, so like I said, Express Care is really for our sick visits, but we do something pretty cool, which is we do physicals, whether it be for your driver's permit, school physical, we do. So, things that normally like a family doctor would do, but nowadays not everybody has a family doctor.
No.
So it's a kind of a nice resource for this community to use. We have a lot of people moving from, whether it's New York or even from different countries that they haven't had anything established yet. So for them to be able to get like a driver's permit physical is nice, or a school physical with the kids that are new. So we do those, which is good. And I think we just lowered our cost to, I think it's $45 for a physical. Self-pay, that's it, and your physical's done for you.
That's fantastic. You know, when you're speaking of that one, I'm going to take a quick break. When we come back, I want you to tell me why you feel Express Care is such a great opportunity for the community, okay? Because you see it. You work it every day.
Right.
I mean, it's just like the same. Tell me about broadcasting. Well, I'm in it every day, but you see it every day. Folks, I'm talking to Alyssa Hartranft, and she's a physician assistant certified, working at Express Care location on Hazleton Shopping Center, Lehigh Valley Hospital, Hazleton. Now, remember, if you're not feeling well and you want to know whether you should go there, it's 570-501-6220. Now, Alyssa brought an interesting point up. A lot of you moving into the area and you don't know where to go for health care, etc. Great opportunity for you to give them a call and have them take care of your health needs. We'll be back right after this. Welcome back to the Sam Lesante Show, folks. Remember, 24/7, SSPTV.com. Download the app, search SSP TV, and download our apps. All of our health shows are on there. Today, I'm talking to Alyssa Hartranft, who is a certified physician assistant working at the Express Care location on Broad Street, Hazleton Shopping Center, and also works at the ER department. Now, first of all, I understand the ER is expanding.
Yes.
That's fantastic news because they do a great job up there. Now, okay, we have a few minutes left. Tell us about times, hours, and everything that's at Express Care,
Sure.
okay? And Tom, if you can, put the phone number up there, 570-501-6220. The reason why I'm telling you the phone number, folks, we run the health shows and we always say another number, but this is for, you're not feeling good, you want to find out if you should go to the Express Care or, give the number. So tell me about the hours.
Our Express Care is nice. It's walk-in only, no appointment necessary. Our hours, we are open 365 days a year, weekends, holidays, you name it.
What happens at leap year? Huh?
We're open.
Okay, you're open.
We're open regardless. We are open weekdays, Monday through Friday, 8 to 8. Weekends and holidays, 8 to 4. Like I said, it's 365 days a year, round year coverage. So yeah, that's ours.
So the reason I give the number is say maybe there's something that's going on with me, and if I call and it's something that you think or who's ever there because you have the experience, maybe they're going to require a CAT scan, maybe they're going to require this. Okay, then you could redirect them up there. But your statement before about how transients are coming in, people moving into the area, and with Can-Do expanding and all these jobs that are being available, people are looking for health care, and I think that's fantastic. So why do you think the Express Care is such a great opportunity for the community?
I think it's for a number of reasons. One, like I was touching on before, it's really hard for people who are established here to sometimes get that sick visit with their primary care provider. Sometimes it could take several days to several weeks. And when you're sick, you don't want to wait that long. So Express Care is a good option for people to come in and get checked out for their acute illness. The other reason is people don't have primary cares. So another good resource to utilize us for. And I think people in the community are probably familiar with how busy our ER can get. And if you have, a sore throat or something, you don't want to wait in the waiting room for 6 hours because you can never predict the volume and the acuity of what's going to come into the ER.
And here again, just so you understand, folks, when you go to the ER department, sometimes people are frustrated because they have to wait, but there's a triage.
Yep.
My wife being an RN, she would know. So very quickly, some people get nervous because they're there waiting and someone's coming. Tell them why sometimes that happens.
So part of it is they don't see the ambulances coming in behind the back door, for one, which can build up the waiting room from that angle. But we're also, we're going to see the sickest first. And sometimes that's, it's good for obviously the sick people, but sometimes for the lower acuity patients, the sore throat, ankle sprain, they're going to be there a little bit. And it's not that we're trying to avoid it, but you got to see what the sick.
And I would hope people would understand. And even at that, You guys do a fabulous job, okay? You know, Express Care, when I was there, you know, and I interviewed people, I knew a few of them, and you're well-trained, you know, they do a great, it's the Express Care unit location, folks, on the Hazleton Shopping Center here. Anything else you want to add before we wrap it up?
No, like I said, we're open all the time, so come see us for your cute stuff.
Well, let me say, Alyssa, you've been a pleasure.
Thanks.
You've been really a pleasure, and I wish you the best. Tell everyone up there, you were lucky to be on the Sam Lesante
Oh,
Show.
absolutely.
Okay. Folks, remember, it's Express Care location. It's 570-501-6220, and it's a great opportunity for anyone who needs health care immediately. We'll see you next time.